Hi, I'm now in my clinics and here comes case number 2. Case number 2, I want to talk about a small patient who came into my clinic at the age of 1 year old. This patient was diagnosed with lots of coughing and trouble breathing, and the doctor said he needs to be treated by asthma. And they did x-rays and really saw that there is a lot of fluids also in the lungs, and he needs to be treated very fast and soon. He just did antibiotic treatments before for pneumonia and all kinds of things, and the cough came back. So the parents came very desperate to the clinic and said that they need help now because they don't really want to start now a 1 year treatment for prevention of the asthma. And of course, if there's a need, do it. Go and do all the treatments there's needed for. The doctor said they will start the treatment next month, and yeah, so I had 4 weeks to try and change the situation. We started laser acupuncture on this small patient. We used continuous wave in this case. I didn't use any frequencies, special frequencies for this age. I normally like just to use continuous wave. Once my teacher, Sean Goodman, gave me nice combinations of points, pericard 6 and liver 2, for releasing phlegm, which is developed by the body when a patient is suffering from, when the patient has growing teeth, okay? You know these kids when they're spitting a lot of fluids out of their mouth all the time and the whole t-shirt is wet of the patient. So this is often the reason because the teeth are growing and then the child gets fever. Now you have to imagine this phlegm is also going down into the lungs and disturbing us really to breathe, okay? And when the child lays down in the bed, it starts even to be more worse, okay? Because now the phlegm is going in all the lungs and disturbing the patient to breathe, okay? So what you should advise, first of all, the parents is to bring up to put a cushion under the mattress on both sides, because this 1 year old will flip around in the bed during sleeping. And so this will help the baby to sleep, okay? With the acupuncture points, we will work on this 2 combinations of points, pericard 6 and liver 2, but also I used large intestine 11, stomach 40, spleen 6, and lung, what was it, 5, okay? I do them opposite sides, okay, not bilateral. 4 points just, okay, and the other 4 points. So overall, you have 8 points in this treatment. The treatment is really, really fast and successful. After 3 days, I got a phone call that the running of the spit stopped. The cough after the second day of the treatment already became less, but was still there. They came for another round of treatment, after 3 days. And then after 6 days already, almost no cough at all anymore, okay? We continued another treatment, 3rd treatment, and then I asked them to go back to the doctor for a checkup, to check the lungs, to check the breathing. There was no wheezing anymore, no coughing anymore, no spit anymore. The doctor said there is no symptoms anymore of asthma, and in the moment they will postpone the start of the beginning of the treatment for asthma. And this was, of course, very happy news. They're now in follow-up with a Western doctor, and it is fine, okay? And this is the strength of acupuncture sometimes, that we just can balance out exactly where the body needs to be, so he can do the healing process as he should, okay? I'm sorry, I'm in the clinic, so I don't have anything to put on the camera in the moment, but I hope it was fine and working well. If you have any questions, ask me in the comments. I love to answer. I guess I didn't talk about everything I needed to, but let me know.